Good morning to all. My study topic is side effects after NETARSUDIL. There is no financial disclosure and no conflicts of interest. Glaucoma is chronic progressive optic neuropathy which leads to characteristic irreversible visual field defect. High IOP is the major risk factor. Glaucoma affects approximately 76 million people worldwide and can be increased to 112 million in 2040. Its leading cause of irreversible blindness. NETARSUDIL is a ROC kinase inhibitor. It decreases the IOP by affecting the aqueous dynamics in three different ways: increasing the tubercular outflow, decreasing episcleral venous pressure, and reducing aqueous humor production. FDA approved NETARSUDIL solution 0.02% in December 2017 in primary open-angle glaucoma and ocular hypertension. For patients who require more vigorous IOP control, NETARSUDIL can be used. This study aimed to find out the side effects of NETARSUDIL and how it affects the course of anti-glaucoma treatment. It's a prospective study in a tertiary care hospital in eastern India from August 2022 to February 23. The patients of primary open-angle glaucoma or ocular hypertension above 18 years or older are included in the study. Non-hypersensitive to other anti-glaucoma drugs, patients of intraocular surgery or trauma, primary angle closure and secondary glaucomas, patients not willing to give consent and follow-up, non-case of ocular surface disorder, pregnancy and lactating patients were excluded. The patients, the demographic and clinical data, duration of glaucoma, duration and frequency of NETARSUDIL, any new side effects developed after NETARSUDIL use, any history of discontinuation of NETARSUDIL or change of NETARSUDIL, other glaucoma drugs were collected. These patients were evaluated at BCVA, slit lamp, IOP reading with Goldman ablation tonometer, fundoscopy, gonioscopy, visual fields, central cornea thickness and RNFL thickness. 70 patients were examined and given NETARSUDIL eye drop fulfilling inclusion and exclusion criteria. Out of 70 patients, 66 patients continued the treatment for 7 months. Out of that, 34 continued without any side effect and 32 continued with some sort of mild side effect. Around 4 patients discontinued the treatment in our study. Out of that, 3 discontinued due to some sort of side effect. The variables such as IOP, BCVA, RNFL thickness and visual field were calculated pre-NETARSUDIL and 6 months post-NETARSUDIL and p-value is calculated. Out of 70 patients, 37 patients developed conjunctival hyperemia followed by lacrimation followed by blurred vision. 47 patients has more than one adverse side effect. Out of that, mainly it is ocular side effect, no systemic side effect, serious side effect and death were found in our study. Out of conjunctival hyperemia, 29 patients has grade 1 hyperemia according to the Mantle slit lamp classification system of conjunctival hyperemia. Most of the patients develop hyperemia between 1 hour to 1 week after the installation of the drop. Our study found out that 50% of developed adverse effect, in which 45% continued study and 4% discontinued the study due to adverse effect. Conjunctival hyperemia is most common adverse effect, followed by lacrimation and followed by blurred vision. 41% of hyperemia is grade 1, mostly seen between day 1 and day 2 after day 1 and 1 week after installation of the NETARSUDIL eye drops and resolved by continuous use. 67% have more than one adverse effect, mainly ocular effect. No systemic adverse effect were found. ROC1 and ROC2 trial shows that incidence of adverse effect is 50 to 53%. Most frequently reported conjunctival hyperemia, which is 61%. 28% discontinued the study discontinued due to some sort of adverse effect. Severity is mostly mildly. Onset is little bit early onset, 50 to 60% within first 24 days of study. Lewis et al. Study reported that greater number of discontinuation taking NETARSUDIL are due to the conjunctival hyperemia. Shirley et al. Suggested that once daily dose will decrease the symptoms during waking hours. Investigative ophthalmology and visual science reported that conjunctival hyperemia is common side effect at months 1 and 3, blurred vision, followed by blurred vision. Bakarki et al. Study shows that conjunctival hyperemia is seen in 57%. The hyperemia fades with time. We concluded that NETARSUDIL has significant reduction in IOP so that it can use as an adjuvant to other anti-glaucoma drugs It has notable side effects such as conjunctival hyperemia, mostly mild grade. It can be managed once daily administration, and it fades with intensity with time. Thank you.
Yeah. Your patients were put only on NETARSUDIL, or they were also?
NETARSUDIL we use as an adjuvant to the some other anti-glaucoma, especially prostaglandin analogs we use.
What other anti-glaucoma medications were they using?
They are mainly using prostaglandin analogs. We use NETARSUDIL as an adjuvant in the patient, those who are not attaining target IOP. Even after that, as an add-on, we given NETARSUDIL.
So if the patients were already on other drugs like prostaglandin analogs or alpha agonists, they can also induce hyperemia. How do you ensure that this hyperemia...
That we are excluded, that patients we are excluded. In exclusion criteria, the patients non-case of hypersensitivity to any anti-glaucoma drugs we are excluded. But still there can be, that is...
Sir,
Can be.
excuse me.
So we are glad to know that, but this is Freepapers and audience interaction is not. Yeah, okay. So how long was the study?
For 7 months. Actually, 6 months we evaluated and 1 month for finding.
And you actually found that the severity of hyperemia came down?
Came down with continuous use. But some patient, 4 patients refused to the, only grade 1 mild degree of hyperemia is noted.
And the reduction of IOP that you're showing is with, pre was with the prostaglandin analog?
With prostaglandin. Before adding NETARSUDIL and after.
Then you seem to have got a fair amount of reduction of IOP.
Mean IOP is almost 3.
Okay. It's contradicting a previous study. Thank you.